Thank you so much, Mike, for that wonderful introduction. I do appreciate it. Good morning, Rick. I must tell you that over the summer, Rick Afabli gave me a call. And this foundation is very, very supportive of a lot of organizations in this community, one of them being the Mirage School. We have a healthcare executive MBA program, and we do a lot with the healthcare forecast. And so I was very delighted to get Rick's call, and he said, Danny, let's get together because these issues are so important. If we can get together, we'll just have a small breakfast, you and me, 4 or 5 people, and we'll have a nice breakfast, and we'll discuss all these issues. And I said, sure, Rick. And of course, then I come in this morning, and we have 500 people here. It's nice to have you at our small breakfast. And I didn't even get breakfast, so we'll see what happens. So my job really is to talk about the overall economy and how that leads into the decisions we have to make about healthcare policy. And so what I would like to do is, as I always do with these kinds of presentations, how many of you have attended my forecast at the Irvine Chamber? Okay, a good number of you. How many of you remember anything I said? It's okay. So what I like to do, though, is take some of the questions that arise during these presentations, add them up, and then make those the focus of my next presentation. So here are some presentations that, some questions that we often get. First of all, graduates finding jobs. Secondly, why is the global economy such a mess? Third, are we headed for a double-dip recession? Fourth, will I be able to retire before I'm 90? That's a frequent question I'm getting more and more of. Next, if so, will I be able to find a doctor? That's another one. And then finally, can anyone play this game? Anyone here know how to play this game? Right? Can anybody solve the healthcare dilemma? So let's take a look at some of these. Let's start with our current graduates finding jobs. And as you just heard Mike talk about, if you talk about the Mirage School, our full-time MBA program, for example, was #1 in placement in the year 2010. And this year, we just finished 90 days, and we're 92% placed again this year. We'll place 100% of our students within just a few weeks. So you can see that if you're in the Mirage School, it looks pretty good out there, even in spite of the crummy economy that we all know exists. So next, what are the features here of the globe? What is this environment that is such a mess out there, and why is it such a mess? And are we headed for a double dip? So if we take a look at some of these factors, the economic forces that are really critical fundamentally behind everything that's going on right now. One of them is the high-tech manufacturing. So we're seeing today that any plants that are operating, any manufacturing, is operating where they might have had 600 people on that manufacturing floor a decade ago. Today they have 100. Big factor. Another factor, the global financial strains we're all reading about in the European Economic Union. Another factor, slower growth in the developed economies. Another factor, emerging capitalistic markets. Another factor. Many services are now computerized. So how many of you go to the airport and find nobody's waiting on you anymore? It's all done with the computer and the kiosks. And finally, we have this sense that many jobs are permanently disappearing from our economy. And when you put all of these together, what you get across the board is a shifting global dynamic. And there are many ways to look at that shifting global dynamic. And one of those ways you can see by this next chart, if you take a look at the percentage of world GDP that's produced in the developed economies, that's that blue line up above, versus the percentage of world GDP that's produced in the emerging economies, you see two very different stories. The developed economies, from 1980 to around 2000, producing about 2/3 of the world GDP, world production. The emerging economies producing about 1/3. And we would always tell these stories about, there's disparity here. Someday, way out into the future, those two lines are going to cross. Well, folks, if you take a look at the next chart, what you'll see is that someday is today. That's happening right now. And you can see this by looking at the percentage of, real GDP growth in these different kinds of economies. But if you look at what's happening in the emerging and developed economies, the purple line, you see that GDP growth is so much stronger than in that dashed line, which is the GDP growth in the advanced economy. So that's the background by which we come into this discussion. So next, if we think about the overall trends, strong economies in Asia, Latin America, and future growth occurring outside the United States. And that leads us to conclude, perhaps, that when you take a look at these divergent economies, and you say, well, let's take a look. Why don't we play let's have a little quiz here. All right, I want you to each think about this. I'm going to present one economy, economy A, which produces 2/3 of the world GDP, 40% of the world's electricity production, 60% of the world's oil production, and 66% of the world's steel production. I want to contrast that with economy B, which produces 20% of world GDP, 22% of electricity, 10.5% of oil, 7.2% of steel. And I want to ask you, can you identify who economy A is and who economy B is? Just think about it for a minute. Get it in your mind. Take a guess. And now let's take a look and see who's economy A and who's economy B. And when you look at data like this, it maybe leads you to the following conclusion, or at least the following question: are we wrong? Right? And the interesting issue is when you look at a lot of the features of our economy, there are a lot of things going on in the U.S. economy that are very, very similar to Rome in the middle of its decline. So that's the bad news. The good news is it took Rome 100 years to decline, so we have some time to figure this out. So what are our concerns? Well, we have heavy debt, strained local, state governments, long-term federal debt issues. And if you take a look at some of the trends, you see the unemployment rate is now heading back up, or stabilizing around 9.1%. Growth is heading down, and so you get this question: are we heading for a double dip? How many think we're heading for a double dip? Okay, a bunch of people say that. My answer to that is, who cares? It doesn't matter. The point is we're heading toward a period of very, very slow growth. It doesn't really matter that much whether it's a small positive number or a small negative number. It's not going to be good. It's just not a happy time for us in the United States economy. So, if we take a look at the unemployment rate at 9.1%, interestingly enough, you have to recognize that below that number of 9.1%, if you include discouraged and underemployed workers, it becomes 16.7%. Then you recognize, well, how are we going to get ourselves out of this? Well, if you have 100 to 125,000 new jobs created in the month, in any month, that kind of keeps the unemployment rate constant. We need more than that. But even if we had 200,000 jobs a month being created in our economy, it would take years for us to get back to around 6% unemployment. So we're going to be in this long period of stagnation. Also, with some jobs permanently lost, we have to recognize that the normal rate of unemployment for the United States is much higher than it was previously. It might have been 5% a decade ago. We're now looking at 6.5%, maybe even 7% as being a normal rate of unemployment for our economy. But the next question, who are the unemployed? Well, it turns out that if you don't have a high school degree, the probability that you're unemployed in our economy today is 15.7%. If you do have a high school degree, the probability is 10%. Turns out if you have a college degree, the probability is 5.1%. And of course, if you're Mirage MBA, the probability is pretty small. So what are our current policy reactions? So we have Ben Bernanke doing Operation Twist, whatever he does with his hands when he does that. And then President Obama trying to get this jobs package through that was essentially tossed out of the Senate yesterday, and they're going back to the drawing board. But even if these things work, they'll have a short-run impact. And here's the real issue. The real issue is that we have, in our economy, in our country today, 10,000 people every day are turning 65. And this is going to continue for the next 19 years, and of course, this puts a lot of strain on our long-term financial viability. Medicare, you all realize the issue. The same thing is true for Social Security. It's a pay-as-you-go system. And there just aren't enough working individuals to support each one of us who are turning 65. We're down to 2.3 by 2030. The U.S. deficit, the size of the debt, currently the deficit is going to top $1.4 trillion this year. The debt, the accumulation of the deficit is topping $4.5 trillion. This has created several problems for us. One of the most difficult problems has been the debt clock in New York City. How do you know that debt clock? Right? So if you take a look at it, what you'll find is that there's an interesting number on that clock. The 14 trillion number is the size of the debt. We needed a larger clock a few years ago, so they had to take down the old clock. Fortunately, some of that stimulus money helped put up a new clock. That's not true. But come back one slide there. But the second number on that clock, the number 118,000. If you can't read it, it says 118,981. Does anybody know what that number is? That's how much each and every one of your families owes on the U.S. debt. That's how much you owe. $118,000 as a family. That's how much you owe. Pay it up. Let's go. 118, every one of you, all your families. Okay. So you see what the issue is, but then this is even more striking because any of you who are in the lending or borrowing industry know that one of the key variables is the percentage of your income that's out there in debt. And so here we take a look at the Congressional Budget Office and their estimates. If we do nothing different from what we're doing today, what will happen to the percentage of debt, as a percentage of GDP? And there's two scenarios here. The first one, take a look at now, is what we call the pessimistic scenario. Look at that number go right off the chart there. And that pessimistic scenario can be interpreted as follows. The United States government will go bankrupt in our lifetimes. In our lifetimes. That's pessimistic. There is an optimistic version. Let's take a look at that. Now, what's the optimism in that? Well, it's that the United States will go bankrupt in our children's lifetimes. So there's some optimistic version. So if we take a look next at how this compares to the rest of the world, well, Greece is way up there. Now, Greece, what's on one axis here is the liability of the budget balance as a percent of GDP, and on the other axis is gross debt as a percentage. So you have to be up in that northeast corner is really not a good thing. So where is the United States in all of this? Let's take a look. Right there. Not a good place to be. I mean, after all, Greece is for sale on eBay. Right? Do we want to be there? Well, we're there. So how does this now lead into the issues that we're facing today? So here we have this simple question. Will I be able to retire before 90? Simple question, simple answer. No. And here's why. President Obama in April of 2011 said about 88% of government spending is made up of Medicare, Medicaid, Social Security, National Defense, unemployment insurance, blah, blah, blah. So 88% there. So that's not all that interesting because we know that. But the interesting part of the statement that he made was that cuts to the other 12% will not solve our problem, which means we're going to have some cuts in what's above the line there. Okay? So next, if we take a look at the reforms that are needed, of course, health care reform, which we're discussing today, Social Security, and the tax code. And unfortunately, what also is needed is some nonpartisanship in Congress and some direction. So what about tax reform? We may get some tax reform, perhaps. That's a little bit hard to gauge because of the political controversy around it, but here is the certainty about that. Everyone in this room will pay more taxes over the next decade. There's no getting around it. And a major contributor to the financial strain is, of course, the cost of health care. So let's now take a look at how we can characterize some of that cost. If you go back to 1965, I think the telling statistic in this slide is the number of dollars we were paying per person in terms of health services expenditure. And back in 1965, it was about $210 per capita. In the year 2009, it's over $8,000. And then on the next slide, what you can see is how much the government actually pays of the cost of health care services. Back in 1965, it was around 20%, and we're approaching 50% today. So why is that a big issue? Well, another way to slice the data is to take a look at the percentage of total spending by the government on health care. And back in 1965, it was 2.6%. Today, it's around 26.5%. By 2016, it's estimated to be at about 30% of all federal government spending being spent on health care. So that leads into a question about what happens when I retire. Is there going to be health care for me? And so Rick is going to answer that one. So let's go to the next slide. In fact, Rick told me he's volunteering to be everyone's doctor, right? So here, can anyone here play this game? Can anyone here solve the dilemma? So what I want to do next is take a look at two considerations, which are always the ultimate considerations of any public policy. So a couple things from it. It's always equity versus efficiency. That's one theorem of public policy. We're always balancing equity versus efficiency. And the second part of it is, remember this, there is nothing more permanent than a temporary government program. So put those two together. Now next, what you need to do to understand this is take a little bit, take a step back and do a little bit of demand and supply in healthcare. So if we can plot the demand schedule The demand for healthcare inversely related to price. Price goes up, the demand for healthcare goes down. But in the supply schedule now, price goes up, people are more willing to supply. Let's go next to the market clearing price and healthcare. This is a picture of efficiency in a marketplace. Let me ask you a question. If I gave you 2 minutes now and asked you to turn to your neighbor, how many of you in this room think you could explain this picture to the person sitting next to you? About 3 people. That's more than exists in Congress. But anyway, so if we take a look at this picture, the reason this is efficient is because everyone who wants to buy services at the current price is satisfied. Everyone who wants to sell services at the current price is satisfied. Resources are being allocated efficiently. Next, what we have now, and when we look at that picture, is an equity argument. We have issues that some people aren't insured because they can't afford to pay. We have access based on precondition problems. We have over 30 million people who have no coverage, some of which simply don't want to buy health care insurance. And so then, how do we solve this equity problem? We say we've got to insure 30 more million patients, or more than that. If we have to insure all these extra patients, what happens to the demand for health care? Well, it shifts way to the right. And if we let this market work, here's what happens next. If we let the market work, of course, the price of health care is going to rise, and the cost of health care services rises. And of course, the number of people now being treated is this number HS, right? But notice that we don't reach actually treating all 30 million patients. So the question is, what do we do next? And since it falls short of the mandate, we have all of these untreated patients out there. And the reason they're untreated is because when the price rose, a bunch of folks decided they couldn't afford that health care and they withdrew from the market. So we have this with this shortfall, and the question is, how do we handle the shortfall now? And this equity or fairness, so the government can step in, and if the government steps in, here's what happens. The government can induce suppliers to cover the remaining folks and pay the extra cost. So if it's too expensive to cover all these people, the government can come in and pay for it. But boy, that's very, very expensive. So the government just sort of shies away from doing that. So instead, what do? We can see next. They try to control the price. Now let's take a look at what happens if they try to control the price. So if the government sets a price where they say, we're going to just keep the price down here, what happens? Well, take a look here. We have all these untreated patients, and this is where we get into rationing. Because the suppliers can't afford to treat all those patients at the government set price. So now we're going to get into a system of rationing. Well, that doesn't seem very happy. That's not a very happy solution. So what else can we do? Well, we could take a look next and see that one solution, which is probably the best solution, is to increase efficiency. And by increasing efficiency, what we mean is we want the suppliers to provide more at the current price. And the way to do that is by inducing some incentives, and we can see that if we take a look next, some incentives to the suppliers by adding ways in which the markets get more competitive, where healthcare providers compete for patients, where competition ends up driving prices down. And ultimately, if we were to do this, we would love to increase supply, as you can see here. And how far would we like to increase it? We'd love to increase it enough to treat all those untreated patients. If we do this, then what happens is that all these untreated patients disappear. We actually have that supply covering the demand at the current price. And then, you know, what we can do is go celebrate. Okay, we'll have some fireworks. So now the question is, so now we know what to do. And if we go to the next slide, the question is, how are we going to get all of this done? Well, there's a whole variety of things that are going to happen, and probably Rick will talk about these in much more detail, but competition of healthcare plans based on price quality, more costs put on the consumer so that you have a more engaged consumer, one that's a wiser spender of healthcare dollars, establishing long-term medical accounts so that we can all save toward our eventual medical care expenditures. We should provide subsidies based on income. We should make the premiums for Parts B and D and income related. All of these things would combine together to get us to a more efficient and also a more equitable solution. And so the question is now, back to, can anyone solve this healthcare dilemma? Well, now you have all the knowledge. Well, you can, right? You can. So the issue is, will it happen? And here's my answer to that. Let's think about what has to happen for all these changes to take place. Well, any plan now has to start with the president and then has to start with the Council of Economic Advisors, the Office of the Budget of the Treasury. So once they get this plan out of the president's office, where does it go next? Well, now it goes into Congress, right? So I'm going to throw it over to the House Ways and Means Committee first, let them just play around with it, all the subcommittees. Then it goes, of course, to the floor of the House for vote. And after it gets through the floor of the House, it goes over to the floor of the Senate Budget Committee, all the subcommittees there, the floor of the Senate next. And after it gets through the floor of the Senate, the bill that passes into the floor of the House, so it has to go into this joint committee, Economic Committee. After it gets rustled around there, it goes back to the floor of the Senate. After the floor of the Senate goes back to the floor of the House. After the floor of the House goes back up to the President. Here we go, all right? And then once it's back up to the President, what happens next? Veto, and we start again. So is this actually going to happen? If we take a look at the next slide, the answer is I don't know. But I will tell you this. As we look ahead, what we're going to see in the overall economy is growth at around 1.5% to 2%. Some inflationary problems are rising of concern. Unemployment is going to decrease very, very slowly. So we just have to get used to this new normal. And then over the next decade, what we're going to see is some combination of higher taxes, higher interest rates, increased inflation, and lower government benefits. That's where we're heading. So finally, I'll just round up with this. And here we have two folks looking over the Dems' past health care plan headlines and reading through it, and here's what they say. And so thank you all very, very much.